Hi everyone, I am Dr. Sagar Sahu and welcome to Veterinary. So today we will be starting a new series, that is the orthopedics, veterinary orthopedics, and we will cover the basic orthopedics. Mostly we will cover the canine lameness, bovine lameness and equine lameness as per the BCI syllabus. Okay, so today will be the first class. This is introduction to orthopedics and basic orthopedic examinations. Okay, so if you are very new to this channel, okay, do subscribe, and if you have not yet subscribed but you are watching the content, please do subscribe. And apart from YouTube, in the Facebook I also post different cases pictorially, but most important one is the Instagram one, where I post all the class notes and as well as some PPTs which can be posted. There is limitation of 10 pictures. So I do post notes frequently and also some case reports which I post in Instagram. So do follow me in the Instagram. So in this particular class, what we will be studying, first some definitions. When there will be any introduction to particular subject, there will be some definitions. Apart from the definition, we will also study the orthopedic examination, basic orthopedic examinations, and we will also learn some special examinations. Okay, we will discuss all those things. So this is the book which I am referring for this particular classes on especially canine lameness. Okay, so I will give the link of this book in the description. In the description you will find 3 links. First one will be of the book from which I am preparing the lectures. Second link will be this PPT in the PDF format. I will also share the link, and the third link will be the notes which I am preparing by my own handwriting. Those notes will be given in the description. Do check them below. Okay, so the first, let us go some definitions. So first is subluxation and luxation. Subluxation, you know that sub means partial dislocation of a joint is known as subluxation, which is very less frequent. More frequent is the luxation, that is a complete dislocation of the joint. Okay, here this is the joint dislocation. Different views you have to take. For your knowledge, we will discuss many of the diseases or many of the techniques. Okay, so don't need to worry, just definitions. Most common luxation, you can see that medial patellar luxation. Okay, in canine also, in bovine also you will find. Bovine is much more common than canine. Next, the definition of reduction, that is fracture reduction, closed fracture reduction, open fracture reduction. There is a particular class, subsequent class you will find a complete lecture on special this topic, that is fracture reduction. But for definition purpose, reduction is basically, you can say that when you are reconstructing or realigning a fracture. Realigning. Reconstructing means you are constructing a fracture anatomically. Okay, mostly anatomical reconstruction. Suppose there is a transverse fracture. This is a bone, and there is a transverse fracture. So you can basically anatomically align. Okay, anatomical alignment. But there are some non-reducible fractures which you cannot reduce. Non-reducible fractures. So for those cases, suppose this is a bone, this is particular bone, and here is a comminuted fracture. The fracture is completely comminuted. Okay, and you cannot reduce this particular segment. So in this particular patient, you have to do the realigning. It means you have to maintain the normal limb length, normal joint mobility, above joint and below joint it should be fixed, so that the limb length does not affect. Okay, so that is basically realigning. Okay, we will discuss vividly for your sake or definition purpose I am telling. So reduction, it is means that reconstructing or realigning of fractured bone. Closed reduction means when you are doing without the surgical exposure, like in this picture. Okay, usually when you will do the external coaptation bandages like cast or spleen, those are basically closed reduction. Okay, so you are basically aligning the bone segments without opening or cutting through the skins and muscles. Okay, that is closed reduction. Open reduction means you have to align or reconstruct the bone by surgical means. So this is basically surgical approach, this is non-surgical approach. This is fracture reduction. Next definition is the external type of split. You see there is a particular segment, that is the definition of fractures I have left, okay, knowingly, because in the next class we will discuss the classification of fractures. So in that particular class we will discuss different terminology associated with the fracture, different types of fractures vividly, so you don't need to worry. So now this is the fixation systems, the external coaptation bandage, external fixation and the internal fixation. First one is the external coaptation. It means you are using cast or splint. You are using cast or splint. Okay, cast like you see POP cast. Okay, or you can say fiberglass cast, fiberglass cast. So those things, those are basically cast. Splint, you know, sometimes you use PVC pipe for splint purpose, or you can see made a splint out of POP also. So those are things. Bamboo sometimes can be used, bamboo. Okay, all those things, these are basically external coaptation bandaging, where you use cast and splint. External fixation means you are using pins, usually intramedullary pin, or in small patient you can use K-wire also. So the pins are used to penetrate the skin and bone, but those pins are connected externally. Here you can see a bar. This is basically linear ESF. We will discuss regarding ESF, don't worry. So this is basically external skeletal fixator. So that is external fixation. Here the skin and bone are penetrated by pin, but they are connected externally. Internal fixation, those are basically using of implants like plate, IM pin, circlage wiring, or combination of pin and circlage wire, combination of pin and plate. So those things, internal implant, when they will be used, that is the internal fixation. These are the definitions. Next, the regarding wires, circlage wire and hemicirclage wire. Circlage wire means when the wire is used circumferentially around the bone. Okay, circumferential. But when it is used in pre-drilled holes, here pre-drilled holes, then it is hemicirclage wiring. Okay. Next, the plates, different types of plates. Okay, the plates, when they are used for different purpose, then it is named according to that. Like the compression plate. This is compression plate. So what does this means? When the plate is used for the purpose of compression simply means the fracture segments, you will attend a compression at this fracture segment, so there will be minimum gap and minimum callus formation. So these are basically compression plate. Here the primary use of this plate is compression. Next is neutralization. Here the primary use of this plate is neutralization. It means when the plate is used in a reconstructed bone. Okay, like here you can see two fractures. This is actually fracture with a butterfly segment. We'll discuss in different classification of fracture, don't worry. So here actually the fracture has been reduced by using two lag screws, but this lag screw is not very much stable. So the further additional support, to provide further additional support, here plate is used. That means it is neutralizing the forces. Okay, so there are different type of forces, axial, then rotational, then bending forces, shear forces. We'll discuss, don't worry. So all those forces, when to neutralize all those forces, the plate is used, it is neutralization plate. Okay, next is the bridging plate. This bridging plate particularly used for non-reducible fractures, comminuted fractures. Like in this image, you can see it is comminuted. This particular segment is completely comminuted. You cannot reduce this fracture. Okay, so here I told you, when you cannot reduce a fracture, you have to think about realigning. That is basically a type of reduction. So in this particular case, the main objective is, you know that on this bone there will be axial load. When the patient will take some load on the limb, there will be axial load. So if you can do something like if this axial force can be transmitted to the distal segment through something. Here it is a plate. So it is, this plate is particularly acting as like a bridge. So it is simply a bridge through which the axial pressure is transmitted from the proximal segment to the distal segment. This is bridging plate. It is acting as a bridge. Okay. Next is buttress and anti-glide. These two particular uses to prevent sliding. To prevent sliding, it is very important in case of oblique fractures. Oblique fractures. So when it is called buttress and when it is anti-glide, when it is used for metaphyseal fractures, then it is known as buttress plate. When it is used for diaphyseal fracture, it is known as anti-glide plate. Like here, see, this is a oblique fracture. This is actually a Salter-Harris type fracture. We'll discuss, don't worry, in the next class. So this, in this particular fracture, this segment, when there will be axial load, it can slide out. Okay, so to prevent this particular sliding movement, here it is a plate is used, that is the buttress plate. Same principle when you are using for a diaphyseal fracture. This is a diaphyseal oblique fracture. So when the plate will be there and then there will be compression force, this particular segment will not slide. Okay, to prevent sliding or gliding. Okay, that is anti-glide. When diaphyseal fracture, it is anti-glide. When the metaphyseal fracture, it is buttress plate. Okay, different basis on the basis of different use, plates are named. There is also another classification when we will discuss the implants, plating, then we will discuss. Next, regarding pinning or introduction of pin, you can introduce retrograde or normograde. So what is retrograde? So in retrograde, basically this is fracture line. You have to insert the pin from the fracture line to the proximal segment, take it out. Okay, then you have to introduce into the distal segment and you have to sit at the distal end of this distal segment. Okay, here it will sit. This is basically retrograde pin. What is normograde? You will start from one end, then go to the fracture side, then to the distal, and where the pin will sit, that is basically normograde placement. Okay, basically it is used in case of pinning. Okay. Next, type Steinman pin and K wire or Kessner wire. Both are pins, okay, based on the diameters. This is 1.5 mm to around, I think, 6.5 mm. This thickness it comes. Then it is Steinman pin. When it is less than 1.5 mm, it is K wire. Usually it comes from 0.9 mm to 1.5 mm. Okay, these are K wires. Basically, on the basis of diameter, they are classified K wire or the Steinman pin. Next, this is basically the deviation or deformities. The valgus deformity, valgus here one L, that is lateral. Okay, valgus, this is valgus, this is lateral. This is the bone, this is lateral deviation is known as valgus. Varus is the medial deviation, just opposite. Procurvatum or sometimes it calls anticurvatum, it means cranial deviation. Recurvatum is basically the opposite, caudal. Okay, this is anti, this is recurve. Anti or pro, they are same. Next, we will go for the orthopedic examinations. First, you can do when patient comes, do the visual examination first. So, visual examination can be standing or sitting. So, in this particular segment or particular examination, you mostly look for the best is the weight, or you can say body conformation, to be very precise. Body conformation, whether obese or thin or moribund, like that, all those things, because when the animal is heavy, you know that you need some good implant or strong implant. We'll also discuss about fracture assessment score in the subsequent classes. Okay, all those things, all the doubts will be cleared. Okay, so while standing or sitting, or mostly in standing, you will observe the body conformation, and then you can see whether the weight bearing is there, or the animal is standing with bearing the weight and the affected limb weight bearing, or you can also check some the hyperextension of limb, hyperextension or hypoextension. Okay, hyperextension. Also you can check some rotations, whether external rotation of the limb or the internal rotation of the limb. While standing you can check. While sitting you can also check the how the patient sits. how he or she, there are also some living things, how he or she sits. Sometimes when the hind limb is fractured, the animal will keep their limbs very straight. Okay, so from these examination you can assess, you can also access the swellings if any present. Okay, swellings can also be assessed. These are basically standing and sitting examination. If you are experienced, you don't need some manipulate. By only looking, within few seconds you can know all these things. Okay, next is gait analysis. Suppose there is some problem with the forelimb, or there is forelimb fracture of any bone like the humerus or radius ulna. So you will find a characteristic gait like head nod. While walking, you will see that animal is nodding his or head. That is head nod, very much characteristic to forelimb fracture. You can also see circumduction. What is circumduction? Suppose that the limb, this is left step, this is right step, left, right. Usually this goes like straight thing. But when suppose the right limb is affected, this will be left, this will be right, left. When this is right, it will not go like straight, it will go like this. This is circumduction. Okay, this type of movement. Mostly when the limb is like paralyzed or hyperplexed, okay, those things, it will move like this, circumduction. So you have to look for those gaits. You can also see the rotation while walking, external or internal. Most easily you can see the olecranon process. Olecranon. If you look at the olecranon very carefully, you can see whether the limb is externally rotated or internally rotated. Varus or valgus deformity, I told you, sometimes in rickets, vitamin D deficiency, you will find some bowing of the bone. Those are basically the valgus or varus deformity. You can look for stride. Usually when animal with fracture, they will have a very short stride. Joint collapse also you can look for. Similarly in hind limb, you will find hip hike or hip sway similar to the head nod. Hip hike means it will keep the affected hip slightly in upper position. Hip sway means slightly, you can say that swaying movement, okay, like swinging movement like that. Bunny hopping, when the animal will be using both of the hind limbs simultaneously, it will be jumping like a bunny. Okay, most very common in case of juvenile hip dysplasia. Okay, hip dysplasia cases you will find bunny hopping. Also, if you will, there will be arthritis, bilateral arthritis of coxofemoral joint, you can also find bunny hopping. Circumduction similar to the anterior limb. Rotation, internal or external. Here you can look for hog joint, most prominently the os calcis. By looking at this, you can also tell that whether the limb is internally rotated or externally rotated. Also, you can look for the joint collapse. These are basically gait analysis. Next, go for the palpation. Palpation can be done standing or recumbent. You can do standing palpation. Some animal will cooperate in standing, and if they are not cooperating, you can go for the recumbent. Okay, sometimes you may need some sedation for the examination. Okay, vicious or fractious patients need sedation. So here, similarly to the gait analysis, or you can say that orthopedic examination of different systems, start from skull, then go for the spine, then the anterior limb, then the posterior limb or forelimb and hind limb. Okay, so in skull you can look for the mandible, maxilla, zygomatic arch. Okay, if you see any skull depression, especially when the animal will come after vehicular accidents, some signs will be obvious, some signs will not be obvious. So you need a thorough orthopedic examination. So first start with skull, then go for spine. While checking the spine, the light palpation as well as deep palpation is necessary for spinal fractures. Though we have X-ray and different imaging systems, better imaging systems, sometimes you need some physical palpation also. Sometimes the X-ray machine will be occupied. For that you can do the orthopedic palpation to know the injuries. Okay, this is spine. Then go for this limb, the anterior limb or the forelimb. Start from first you see bone, joint and muscle. These things. Orthopedics is basically study of musculoskeletal system. Oh my god, I didn't tell you about the orthopedic definition itself. Okay, so we'll start from bone, joint, then muscles. Bone, scapula, humerus, radius ulna, carpal, metacarpal and phalanges. Then joints, this is the shoulder joint, elbow joint, knee joint, then carpophalangeal joint. These are things regarding joints. You should know something. So regarding the shoulder joint, this particular joint, when the shoulder joint will be flexed, like the limb will be flexed like this humerus will be parallel to this spine. If it is not parallel or there is some difficulty during work, you may suspect some joint disease. So similarly, when this humerus will be extended, it will be nearly parallel to the spine, but it will not be exactly parallel to spine. Next is the elbow. So when the elbow is hyperextended, the humero-radial angle, this angle will be 180 degree. 180, nearly 180. But this joint, when it will be flexed like this, so this radius and ulna will be in very acute angle. Okay, very acute angle. If you are not able to move this particular radius and ulna to make it very acute angle, you may suspect maybe some joint disease of elbow joint. Next is this knee joint, or you can say the radiocarpal and metacarpal joint. So this joint, when it will be flexed, it will flex to this side. This digital pad will touch this antebrachium or the proximal radius and ulna. Okay, so when it will be flexed, it will be nearly 180 degree. So you have to remember all these joint mobilities. Apart from joint, you can check for the muscles like supraspinal, infraspinal, then the biceps brachii muscles and the triceps muscles. All those things you can check for. Any atrophy is there, then you can check. Coming to the hind limb, you have to check for this is femur, tibia, fibula, the tarsal, metatarsal and the phalanges. These are bones, joints. Most probably we will be checking the stifle joint, hog joint, then this is metatarsal and phalangeal joints and interphalangeal joints. Regarding the stifle joint mobility, when this particular joint will be flexed, this hog will touch the pin bone. Okay, and when it will be flexed, when it will be extended, this toward this side is the extension. It will be, the limb will be 190 degree. This femur and tibial angle, it will be kind of purely straight, not exactly 180, but it will be very straight. Another thing, when it will be completely extended, okay, in that extension you cannot flex this particular hog joint. This hog joint cannot be flexed if this the stifle joint is extended. It also means that if you cannot flex, it is good, because the Achilles tendon which will be attached here, that is normal. If during the extension this particular joint, that is the hog joint, can be flexed, it means there is some problem with Achilles tendon. Maybe there is some gastrocnemius muscle rupture or tendon rupture like that. Okay, so you have to know that those things also. Okay, so this is basically the joints. That is how here also you can check for the muscles, the biceps muscles and the quadriceps muscles. All those muscles you can check. This is basically the orthopedic examination. Regarding some special test, what you can do, this is a test, that is the drawer test and tibial compression test. It is used for the cruciate ligament injury. Cruciate ligament injury. For these two tests are done. Drawer test is basically a passive test, while the tibial compression test is an active test. So how to perform this test? First one is the drawer test. This is the pictorial presentation of drawer test. So first you will be standing at the back of the animal. Through the right hand, place your thumb behind the sesamoid bone, that is the fibula, sesamoid bone, behind the sesamoid bone, and your index finger will be over the patella. This will be over the patella, the rest of the fingers on the medial side. On the left hand, you see I am telling right left. If you are a lefty or you are very comfortable with the reverse, you can do that. So the left hand, your thumb will be behind the fibula, and your thumb will be over the tibial crest. So how to perform? Slightly flex this staple joint. You have to slightly flex this staple joint, fix this femur. Okay, then by using your left hand, try to move this tibia cranially and distally, okay. If there will be cruciate ligament injury, that is positive drawer test, you can move this tibia around like 2 centimeter or more, or 1 centimeter or more. Okay, this is drawer test, positive drawer test. It means there is injury to cruciate ligament. Similarly, tibial compression test, you have to hold just like this one. On right hand, here will be right hand, place the fix the staple joint, hold with thumb behind this sesamoid, and on the index over the patella, touching the tibial crest. Okay, and rest of the finger on the medial side. So slightly extend. Here you did the flexion of the staple, but here you have to slightly extend the staple joint. When during that mildly extended state, try to flex the hock. Try to flex this. This is hock joint. Try to flex the hock. If there will be cruciate ligament injury, you can feel the thrust of this tibia going cranially and distally. Okay, so if you feel the thrust, then it is a positive tibial compression test. It means the cruciate ligament has been injured. Okay, there are some videos of different veterinarians regarding this practical demonstration of these tests. You can check them out, but the theory behind this is this. Next, the Barden's test and Ortolani maneuver test. These two tests are performed for diagnosing juvenile hip dysplasia. Usually it ranges the age from 4 months to 1 year. Okay, so what is Barden test? First one is the Barden test. You see, notice the side. This is the dorsal side here. This is the patient. This is dorsal side. This is the ventral side, and this is the lateral side. This is the medial side. Okay, this test is very simple. The principle is you have to subluxate the femur from the acetabulum laterally. This is lateral side. So what you have to do, you have to hold this femur or at the level of stifle. Then you simply have to lift. You have to lift this one to subluxate the femoral head from the acetabulum. Okay, then place it back. In normal animal, you cannot subluxate. Okay, or there will be very minimal subluxation. But in case of juvenile hip dysplasia, you can subluxate. It may be 1 centimeter or 2 centimeter or even more. Okay, so if you are finding this subluxation, then it is a positive Barden test. It means the animal is having some hip dysplasia. Similarly, the Ortolani maneuver test, here slight change of principle. What you have to do, this is dorsal side, this is ventral side, this is lateral side, this is medial side of this particular limb. Okay, so here what you have to do, you have to subluxate the femur dorsally. Here it is laterally. You have to lift the limb, but here you have to push the limb dorsally, so that the femoral head will be subluxated from the, here you can see this is the acetabulum, this is femoral head. So you have to press this femur dorsally, make this limb parallel to the table, then simply push toward dorsal side. So when you are pushing the dorsal side, it will subluxate and make it to the acetabular rim. After subluxating, simply abduct the limb, abduction. Okay, lift the limb, abduction. When you will abduct, it will slip from the acetabular rim. This is the acetabular rim back into the acetabulum. So when it will be back into the acetabulum, you will feel or you can hear a sound, click. Okay, or also you can feel by hand the click sound. When you will be able to subluxate this femur, and you will, while the abduction, when it is you are feeling the click or hearing the sound of click, it means it is a positive Ortolani maneuver test. It means the animal is having some juvenile hip dysplasia. Okay, for younger patients. So these are basically the principle behind the Barden test and the ortolani maneuver test. Without going for X-ray, you can perform this test, physical test, to know the problem or the hip dysplasia. Next test is for hip luxation. What you have to do for hip luxation? You have to place your finger between the space between this is the greater trochanter and this is ischium, tuberous chair. So between these two, you have to place your finger in normal. Then you have to do the external rotation like this. External rotation. This is internal rotation. This is external rotation. When you do the external rotation, if it is normal, your hand will be pushed away. Okay. If there will be hip luxation, then this greater trochanter will move over your finger. Move over your finger during external rotation. Okay. This is normal. It will be displaced. If it is luxated, then it will simply move over your finger. That is positive test for hip luxation in canines, canine and feline also. Apart from that, you know that you can go for imaging, nothing doubt. You can go for X-ray, you can for CT scan, you can go for the MRI also if you have the facility. Okay, these are also some techniques. Physical palpation, sometimes I told you that the X-ray machine or the CT machine or MRI machine may be occupied. So till then you can do the physical test and at least you can have an idea. Then you know that which part to be imaged. Okay, that will become very clear. Then the pain management, we will discuss very vividly regarding the pain management in the third class, subsequent classes. Okay, so don't worry. For your basic knowledge, you see there is a debate regarding whether you should use opioid or NSAID for orthopedic cases. Okay, the book suggests that you should always go for opioids. It is a better drug of choice for pain management in orthopedic patients because NSAIDs are very good for the mild to moderate pain, while the orthopedic pains are moderate to very severe pain. Okay, so for those you need opioids, which is very fast acting. We will discuss very vividly during the orthopedic patient management class. After this, there will be fracture classes. Then after that, we will go for orthopedic management classes. There I will discuss regarding the opioid and NSAID. There is also a lecture regarding opioid versus NSAID in anesthesiology section. Okay, where I have discussed regarding the preemptive analgesia and use of opioid in the preemptive analgesia. I will give the link of that particular lecture in the description. You can check that out. So there is also other medications. This is opioid, butorphanol. You can use butorphanol, you can use buprenorphine, you can morphine, hydromorphine. Okay, all those things, those are basically opioids. This is morphine sulfate. Also, you can sedate the patient if the animal is in very much pain. You can sedate the patient with xylazine. You know that xylazine is very good analgesics, as well as you can combine with ketamine. Ketamine is also having some analgesic properties. Ketamine has superficial analgesia, xylazine has a visceral analgesia. Combination can produce very good analgesia. They are anesthetic also, but analgesic also. Okay, in some patient you have to decide which thing you have to use. We'll discuss opioid and NSAID in the third class. Don't worry. Next is the post-operative care. If you are going for arterial surgery, also during the orthopedic patient management, I will discuss some things. But for some beginners, so you need that post-operative care. You need a bandage change, regular bandage change. Okay, regular monitoring, X-ray regarding the healing, and you can go for the physiotherapy, combination therapy with medicine. You can go for prescribe for physiotherapy lessons, especially important for orthopedic cases. Okay, the physiotherapy, all those comes under post-operative care. Okay, so this is basically the first class regarding the definitions and some examinations, and some I was actually highlighting the special examinations. Okay, so next class we will discuss the definition of fracture and also the classification of the fracture. Okay, so the note to this class is in the description. To check them below, and don't forget to subscribe to this channel. So we'll meet in the next class. Till then, tata, bye bye, take care.